These are my relative disclosures. Bone is a very dynamic tissue, and we can see that there are changes throughout the lifespan. So childhood is characterised by constant growth, which is similar in boys and girls, and we actually have data that shows that boys actually have a wider bone, even though they're accruing the same amount of bone as girls. But it's during puberty that we see the divergence in the sexes. So for example, we see that during that pubertal period, girls increase their bone mineral density earlier than boys, but boys have a much larger magnitude of gain during that pubertal period. So adulthood is marked by a period of bone maintenance, and as you can see from the graph, that males start adulthood with a much larger skeleton. And then in old age, we see a decline in bone in both males and females, and we see during that menopausal period there's a rapid decline in bone. So if we look at the role of dairy across these particular times, in particular, growth is the time in which we can add bone on. But during growth, we see that there is quite a mixture. If I had a group of children in their last year of primary school, you'll have some that are quite small. You may have others that have actually gone through puberty. So it's important that when we're looking at children, that they are matched for maturity, so that maturity itself doesn't perhaps skew results. So one of the few trials that actually did this well supplemented young girls with milk, and as you can see from the graph, the milk supplemented girls accrued more total body bone mineral density relative to the controls. Now, the feature of this study that perhaps made it as successful as it was is that their calcium intake was moderate. They used just one sex, so girls only. And again, if you look at the graph to the left, you can see if I had boys during that pubertal period, their growth could often mask what's occurring because of the dairy. The girls were matched for puberty. They had very few dropouts, and these girls had good compliance. Now, this issue of compliance I'll bring up repeatedly because the benefit of dairy is in its consumption, and its consumption across the lifespan. It's not a thing that we can have once and then not have again. It should be part of the overall lifestyle. So during adulthood, again, we have this period of bone maintenance. Few of the trials that are done have been in premenopausal women. This is one trial in that the women in the dairy supplemented group maintained their lumbar spine bone mineral density, in contrast to a loss in those in the control group. Now, the consumption of the dairy represented by the calcium intake in the table below, you can see that they've actually maintained good compliance over the 36-month period, because they've maintained this high calcium intake, in contrast to the controls that were consuming just sort of nearly half of what the intervention group consumed. So in contrast to that, this trial also looked at lumbar spine bone mineral density, also using milk as the medium of dairy, and we can see that there was an increase at around 6 months, but that increase was no longer evident from 12 months onwards. And again, if you look at the dairy consumption represented by the calcium intake, their calcium intake went down in the 2nd year. So again, this is pointing to that issue of compliance. When compliance was good, the benefits of the dairy were obvious. When compliance is low, we're unlikely to see a benefit. And then finally, during adulthood, or older age, I should say, we get that decline in bone. So the idea here is to slow down the decline. And I'm going to point to 2 trials. This first one is again in women only, and they're postmenopausal women. And what we observed here was total body bone mineral density was maintained in the dairy supplemented group for 30 months, in contrast to the controls where we see this slow loss of bone over the 30-month period. And again, when you looked at the calcium intake as a measure of compliance with the dairy, we can see that the dairy group consumed over 1,100 milligrams of calcium per day, in contrast to the controls. This next trial is one of the few that included males in the trial using just milk. So what I've tried to do with this work is represent trials that have used just dairy, not dairy as a vehicle for another nutrient. This is a short-term study, only 12 weeks, but interestingly, when they consumed 3 extra glasses of milk a day, we saw an increase in IGF-1. So this is starting to indicate that we have an ability to alter muscle as well as bone. And the panel on the right, we see the parathyroid hormone was lowered in the dairy supplementation group. This is representing a suppression of bone resorption with dairy consumption. So bone fragility is a problem if a person fractures. Someone can go through life never fracturing and could have bone fragility. So the primary outcome that has not been looked at yet when we look at dairy and bone are fractures. There are 2 periods during the lifespan when fractures are high. The first period is during adolescence in both males and females, but more specifically in males. This is thought to be for 2 or a number of reasons, but the 2 key reasons is during puberty, peak height velocity occurs about 6 months before peak bone mineral content velocity. So what we have is an acceleration in the length of the bone and a delay in the consolidation of the bone. And this is believed to produce a period of transient fragility. But also we know that adolescents often have high risk behaviours as well, so we have to remember that. The other period of time is old age, and we can see again in both males and females that there's an exponential increase in fracture risk in older age. So what we've lacked for this entire time to date is we've not had a randomised controlled trial looking at dairy food, just dairy food, and fracture risk reduction. So the trial that I'm going to demonstrate to you today was done in older adults in aged care homes. There was a number of reasons for this. 1, 30% of all the hip fractures arise from aged care homes. As an example, in Australia, only 6% of people over the age of 65 live in an aged care home, yet they contribute 30% to the total burden of hip fractures. We also know that their rates of falls are extremely high, and it's 5 times higher than if I have similar people in the community. They have high rates of malnutrition. 68% of residents are malnourished or at risk of malnutrition. Their calcium intake is low. In this case, it's less than half of recommended. Their protein intake is under 1 gram per kilogram body weight. And also they have low dairy intake. In this case, we observed it was 1.5 servings per day. So in explaining this, the servings of dairy I've represented down to the left, and it's 250 ml of milk, 200 grams of yogurt and 40 grams of cheese. So this may need to be converted to the dairy servings relative to you. Again, key stress is that we're using just milk, yogurt and cheese in terms of the dairy that's provided in this trial. So in order to see the number of fractures and have the power to detect fractures, this trial involved 60 aged care homes and over 7,000 residents. 30 of the homes were randomised to provide extra dairy on their menu, and the other 30 homes went about their usual menus. We followed all 60 homes for 2 years, and we monitored all falls, all fractures and mortality. In a subgroup of residents, we did more extensive testing, and we looked at bone density and structure and bone metabolism. This intervention was provided through the food service at each of the aged care homes. By this, all residents were able to have the options of the dairy. The dairy was put across the entire menu so people could choose. We used dairy foods that residents selected more than dictating what they were to consume. Some of the methods that we used was we added dairy, so it might have been cheese or yogurt, to snacks. We fortified milk with skim milk powder to increase the protein and calcium content. we substituted things like gravies for cheese or milk-based sauces, and we modified recipes to increase the dairy content. So if we look first at the top left-hand panel, this is the number of dairy servings that were consumed over the 24-month period. On average, the residents consumed 3.5 servings, and the key point, as mentioned earlier, is that they maintained this intake for the 24-month period. The panel below is dietary calcium, and again represented through the dairy. Their intake was around 1100 milligrams per day for the 24-month period. Dietary protein increased to 72 grams per day in the intervention group, which is yellow, and they achieved an average of 1.1 gram of protein per kilogram body weight, unlike the controls, which were around 0.9 grams per kilogram body weight. And interestingly, there was no change in energy intake. So often we were substituting nutrient poor foods for the dairy food. When we look specifically at the data, this is the cumulative probability of an event, and our intervention is in yellow. So those that were consuming from the high dairy menus, we observed a 33% reduction in all fractures, and specifically a 46% reduction in hip fractures. And the deviation in the two curves was significant at around 6 months. When we looked at falls, we observed an 11% reduction in falls. Now keep in mind, if you look in the control group, over 60% of residents experienced a fall over the 24-month period. And to put it into perspective, we observed 23,000 falls over that 24-month period over the 60 facilities. And what we observed is that mortality was unchanged. So we have residents that were living the same period of time, but with fewer fractures and fewer falls. When we look specifically at some of the potential mechanisms of the benefit, we observed that in the blue, which is the controls, we observed around a 2% loss of bone mineral density at the tibia and the radius, in contrast to the dairy supplemented group where bone was maintained. And again, when we looked at bone metabolism, we observed that in the dairy supplemented group in the yellow, that there was an increase in IGF-1. And for CTX, which is the marker of bone resorption, so how quickly the bone is breaking down, we observed that the controls continued to increase bone resorption that was maintained or halted in the intervention group. We also looked at body composition, and in our dairy supplemented group, we observed that weight was maintained. Specifically, when we looked at lean mass of the arms and legs was maintained, in contrast to our controls where we observed significant weight loss, and this weight loss was occurring both from loss of muscle at the arms and legs as well as fat mass. And in Australia, weight loss is a significant indicator of quality in a facility, so it has a large bearing on how well that the facility is actually being judged. Malnutrition risk. We use the mini nutrition assessment tool, and we observed that amongst all the residents, that those in the control group, we observed a 1-point reduction in the mini nutrition assessment score, but this was maintained in the intervention group. And when we looked at the categories within the mini nutrition assessment tool, the categories of malnourished, at risk of malnutrition, and normal nutritional status, if you look at the blue, which represents the controls, we can see compared to baseline, there were fewer people in the normally nourished group, and there were at 12 months there were more people in the malnourished group. So people were shifting into a category that was one worse than they started. In contrast to the intervention group, we see that that very much just maintained the category that they were in. Now, malnutrition has a significant increased risk of falls, and we also see a non-significant risk of people who are at risk of malnutrition. So this may partly explain some of the differences that we saw in the rates of falls. So in contrast, when older adults that had low levels of calcium and protein intake consumed 3.5 servings of dairy per day, we observed a 33% reduction in fractures, a 46% reduction in hip fractures, an 11% reduction in falls. We slowed bone loss. We improved IGF-1 levels. Residents were able to maintain their nutritional status and also maintain their lean mass in their arms and legs. So in a sense, what we have done with just by providing additional dairy food is that we've slowed the age-related increase in risk in all of these factors. And one of the points I always say is that malnutrition is not a normal part of aging. And so we can see that the bone loss, the muscle loss, we were able to slow that simply by providing milk, yogurt and cheese. There has been some modelling done that looked at if we increase dairy consumption, the cost effectiveness of it. And you can see from the graph that the benefits were more pronounced in women in France because a greater proportion of those women had calcium intakes below 600 milligrams per day. If you look at the cost of dairy, it ranged between 0.4 to just under 0.7 euro. So the cost of the intervention that we did was around 0.5 euro per resident per day. So a relatively cheap intervention that proved to reduce falls and fractures. The cost of a hip fracture is divided between the acute setting, so during the hospital stay where the greatest burden of the cost is involved. Then we see there is a portion during the rehabilitation period, but more importantly, there is additional costs to the aged care home in the year following the fracture, likely because the person may need more assistance and more time spent with them. So again, when we looked at the cost of the dairy food with this intervention, it was around 180 euro per resident per year. The benefit of any research is how we translate it into policy and practice. So, for example, ensuring nutritional standards for food provision in aged care, education for staff, etc. One area of interest is when we look at the dietary recommendations for both calcium and dairy foods, they vary substantially around the world. So if we're to look at the line, we can see that the dietary recommendation for calcium in the UK is 700 milligrams, in contrast to in Australia where it's 1300 milligrams. And also the serving sizes of dairy vary between different regions. So some common ground between these may ensure that we are providing enough dairy and enough calcium to minimise fracture risk in older adults. So in conclusion, dairy foods, namely milk, yogurt and cheese, are important sources of calcium and protein amongst the other nutrients that they provide for older adults in care homes. And this is shown to reduce fractures, falls, weight loss and malnutrition risk. And these benefits are likely in other individuals with similar fracture risk profiles and levels of calcium and protein inadequacies. So with that, thank you very much for your attention, and I look forward to questions during the panel. Thank you very much.